I will tell you the day that we signed our affiliation agreement, I looked at our chair and said, I think we just secured our future for the next 100 years.
The healthcare environment today is extremely challenging. It's just becoming harder and harder to be a standalone hospital.
Being a part of a small hospital, in particular a rural hospital, there's many resources that we wouldn't have if it weren't for being part of a large integrated healthcare system.
Being part of a system really helps us defray a bunch of costs.
You have better economic stability. You can raise the bar for quality if you have some level of size, some level of scale.
We're in a relatively small community. Recruiting providers is difficult. There's just not many of them out there.
It's hard to recruit a cardiologist to those markets. You're never going to get an endocrinologist. You're never going to get a perinatologist for complicated birth.
We find it's easier to attract, to be able to retain by joining the organization that's a large system. They have colleagues that are all the way across the organization that provide them with support.
That infrastructure has allowed us to recruit. Now we have 5 cardiologists out there. We have a cancer center with 6 hematologist oncologists contributing in those markets.
The cost of technology, the cost of innovation in healthcare is high. There are communities out there that can't afford an MRI, they can't afford EMR technology. Being part of that larger pool of resources where you can spread the resources around and in effect raise all boats.
All of our community health centers have technology and information systems designed to integrate behavioral health care with acute care and primary care in every single one of our 12 community health centers.
By being a part of a larger organization, it allows us to extend critically important cybersecurity services to these organizations that, again, on their own could never afford it.
There's just a tremendous growth in AI technology services that are coming available in the healthcare world. One thing that we're pretty excited about is the ability to tap into that technology.
The pace of technology today, that requires regular investment. The systems tend to be better equipped to do those things.
We have a very strong philosophy at Ohio Health of keeping care local, regardless of the size of the community.
And that local care is dependent on the local hospital. It can be a critical access hospital that's having trouble funding for the last 10 years. It could be a rural hospital. We've been bringing in some of those hospitals into our system because they can't do it, but we care for those people.
Since we've been part of Cedars-Sinai Health System, we've expanded our cardiac services, our cancer services, our orthopedic services. Your community still can have that level of expertise without having to travel.
So in every single case where we've invested in a smaller community, the level of care in that community has risen and the number of people who stay in that community has risen.
I think health systems have great perspective. I think they're the ones that see really the downstream impacts of where a community either does well or falls short on some aspects related to overall health.
What we see is the advantage of leveraging those learnings. The fact that it's in a system allows it to be spreadable and allows people to be able to share, those learnings.
Knowledge transfer, physicians that can work quicker and better with each other. By pulling all the hospitals in and all of our resources, we make sure there are people that are not falling through the gap.
There is an opportunity in both directions across the system to really be innovative and really kind of push quality in terms of what best practices are.
So I'm proud to be a part of a large integrated healthcare system. The scope allows us to narrow down and focus on a singular person and be able to help them live their best life.